I would like to know, when you're elected president, in the first 100 days, what are the three main goals you want to get passed to help this country get back on its feet?
There you go. My first priority is, if we have not gotten out of Iraq yet, my first priority would be to get our troops out of Iraq, stabilize the situation there. Because I think it is very hard for us to make progress internationally on a whole range of fronts where we've got to make progress while that still lingers. I mean, I just mentioned the issue of climate change. That's an international problem. But unless we've got some credibility in the world, it's hard for us then to go to China and India and other fast-growing countries that are putting in a coal-powered plant just about every day without us actually doing something about our own situation here at home. It'll be hard for us to make progress between Israel and the Palestinians while Iraq lingers on. It'll be hard for us to deal with nuclear proliferation, which I think is the single biggest threat to our long-term security. And it goes beyond Iran and North Korea. As serious as those problems are, the fact is we've got many countries that potentially have the technology, the capacity to start developing nuclear weapons. Up until now, they haven't, because the Nuclear Non-Proliferation Treaty has said, you know what, we'll give you nuclear power as long as you don't develop it into weapons. But that whole regime is starting to break down, and we've got to restore it. So, number one priority, Iraq. Number two is healthcare. I think that we are going to have to set up a system where, first of all, for those who don't have health insurance, the 45 million who don't have health insurance, they are able to buy into the kind of healthcare plan that I enjoy as a member of Congress and every other federal employee does. It doesn't make sense. It doesn't make sense for me to have this healthcare and my bosses, the taxpayers, don't. So they're going to be able to buy into a pool that enjoys group rates. Insurance companies that want to participate, they can't discriminate it on the basis of pre-existing conditions. Drug companies who want to participate, you're going to have to negotiate for the cheapest prices on prescription drugs. And for those people who can't afford to buy into the system, even with group rates that are set relatively low, then we provide a subsidy to make sure that everybody is covered. The second component is a catastrophic insurance aspect to it. And what that does is it helps those who have insurance but are seeing their premiums going up every year. And I'm sure there are people here who have seen this, because families in the last 5 years have seen their premiums go up an average of 87%. And small businesses and large businesses are burdened by these rising costs. One of the things that you do with a catastrophic insurance component is you say to employers, we'll cap the out-of-pocket expenses that you have when you've got a serious illness with one of your employees. Let's say we cap it at $1 million or something. That way we can stabilize premiums. It's basically a reinsurance program that allows us to stabilize premiums as long as the savings in those premiums are passed on to the employees. They can't be pocketed by the employers. They've got to be passed on to the employees. But that can help control the costs, and we estimate we could save a family of four as much as $1,000 a year on their premiums. That would be important. Now, the third aspect of it is we've got to actually save money in the system as it's already constituted. It doesn't make sense for us to simply put more money into a system that is not well designed. So we've got to put more money into prevention. We spend 5 cents out of every dollar on prevention on health care. 20% of patients account for 80% of the costs of health care. And if we take somebody, for example, is diabetic, and we say, we're going to make sure that we monitor so that you're taking your medications regularly, you're eating properly, you're visiting a podiatrist, then we don't have to spend $30,000 on a foot amputation. That saves us money. And technology. Healthcare is the one area where everybody's still filling out forms and faxes. And there's huge errors that arise out of that. Every time a nurse can't read the proper dosage to administer because the doctor scrawled it, that can result in significant adverse events in a hospital. You do those three things, we can save $75 billion every year that can then be applied to the subsidies to help make sure that everybody has basic health care. So, and the last domestic issue that I would want to just make mention of is education. I think on that front, expanding early childhood education and really promoting teaching as a profession are the two single most important things that we can do on the education front. So.